yesterday. Ministry of Health, Republic of Liberia Health Financing Policy on the Liberia Health Equity Fund for Life, Liberia Social Health Insurance Scheme for Universal Health Coverage. A stakeholder meeting to validate the actuarial analysis report for the life. Date March 24th, 25th, 2025 at Pakistan at the Golden Key Hotel. Thank you. We hope that you have done the registration and verify served. We are done our prayer. We will do the self-deduction. We will keep our ventilator for the far left. Which Minister Joe do, I decide the introduction of the RPO. For now, we will do the rest of the self-deduction. And I will start with myself. My name is G. Martin Lumen, working for the Ministry of Health as Director of Policy and Planning. So I will start on my right hand side and move to after Mr. Jacob and introduce RPO. Thank you.
Good morning, my name is George P. Jacobs. I'm Assistant Minister for Policy and Planning for the Ministry of Health.
Good morning, I'm Michael Handel, a consultant of Actuarial Services for the health scheme.
Good morning, I'm Edward Boo. I'm the Technical Assistant for Projects in the Office of the Development of Deputy Minister for Administration. Thank you.
Good morning, I'm Dr. Tony Republic County Health Officer, Liberia County. Thank you.
Good morning, everyone. My name is Lily Liu. I'm the Program Director with the Clinton Health Access Initiative.
Good morning, and Dr. Moses Masika. I'm the Country Director for Clinton Health Access Initiative.
Good morning, everyone. I'm Scarlett Love to see the Universal Health Coverage Financing Specialist for Partners to Health.
Good morning, my name is Confidence and Wonderful, Deputy Chief of Nursing and Midwifery Officer, MOH.
Good morning, I'm Dr. Udo Wanekome, Director at attendees, Ministry of Health.
Good morning, I'm Dr. Kessel Libagoya. I'm the officer in charge of the health team.
Good morning, I'm Dr. Sila Kramer, County Health Officer of Liberia County.
Good morning, I'm Dr. François Tibogo, CHO Rewarding.
Good morning, everyone. I'm Dr. Joel Tapekoli, County Health Officer of Montreal County Health.
Good morning, everyone. My name is Mama S. Bravo, Budget Officer, Finance Ministry, Health Sector.
Good morning, everyone. My name is Tiala Kopo Mova. I'm the Program Manager of the Healthcare Federation of Liberia.
Good morning, I'm Olu S. Johnson, Chairman of the Board of Directors, Healthcare Federation of Liberia.
Good morning, my name is Danny D. Moses, representing the Superintendent of IDB County. Good morning, my name is James Dalla, and I'm Legal Counsel, Ministry of Health.
Good morning, I'm Peter Papia from NARCO.
Good morning, everyone. I'm Nana Ejiomita, Sajona Insurance Brokers. I'm an actuarial analyst.
Good morning, everyone. I'm Fatu Kamara, Pastor of the Deputy Chief of Party on the Global Fund in CRS.
Good morning, my name is William E. Walker Jr., Head of Secretary for the Liberia Health Equity Fund and Global Fund Partnership.
Good morning. My name is Ansel Ramses T. Kumbuya. I'm the Executive Director of the Law Reform Commission.
Good morning. My name is John Alexander Engineer. I'm the National Co-Chair of the Social Council of Liberia, Executive Director of Chelsea Program.
Good morning, ladies and gentlemen. This is Simon Mamalu, Chairman of the Board of Directors of the National Insurance Company of Liberia.
Good morning, everyone. My name is Morton Chapa, and I'm the Managing Director of MICRO.
Good morning, everyone. I'm Yeta Idole, Superintendent of Public Company.
I'm Aaron Elwi Sambi, Superintendent of the West County.
Good morning, my name is Robert S. Peel. I'm the Actuarial Coordinator for the National Social Security and Welfare Corporation.
So let me introduce myself. I'm a Director Kone Dotlet. I work for the Division of Health Financing.
Good morning. I'm pleased to represent the Superintendent of Liberia County.
Thank you. Thank you very much. I think we have the required stakeholders in this hall. I'm very happy that the civil society people are here, the insurance brokers are here, the NGOs and partners are here. We'll now call our resource speaker of the Assistant Minister of Operations and Planning to introduce the hard table. Thank you.
Good morning, everyone. Sorry. We have two people that are not here.
Okay, my name is Adam Pizzo, CHO Grand County. Good morning. I'm Dr. Drew Wiza, the County Health Officer of Liberia County.
Thank you so much.
And the Grand
So at this point, I'm very honored to recognize and introduce our platform guest. I will start with the Honorable Director of Cabinet, Representative Pablo. The Republic of welcome. Please wait your hands to go. This is the Cabinet. Next, we have Honorable Augustine Chiro, is the co-chair of Health in the House of Representatives. Welcome, sir. Next, Honorable Chiro is Honorable P. Marjorie, is the chair of Ways, Means and Finance in the Senate. Is the Senate? Yes, in the Senate. Welcome, welcome. And of course, last but not the least, is the Honorable Deputy Minister of Health of the Republic of Liberia for Policy and Planning. Malaya Tamachi. You are welcome, Honorable. Thank you. So those are our platform guests. You are all welcome to this all important occasion. Thank you.
Now that we have the project of housekeeping, at the rear there you have the washroom, one for female, one for male. They are labor realistic, please. I'm now going to call on Anthony Malaya Tamachio, Deputy Minister for Policy, Planning, M&E, Ministry of Health, make a web report.
Honorable Chairman, Co-Chair on Health Committee in the House of Representatives, Honorable P. McDury, Chair on Will, Means and Finance Committee, Honorable Nathaniel Kwabu, Director General of the Cabinet, Superintendents here present, Minister Jacobs, Directors and County Health Officers, distinguished, Honorable Managing Director, NACO, Honorable Ramsey Kimaya, Executive Director, Law Reform Commission, distinguished ladies and gentlemen, it is indeed a wonderful time to gather in this hall to discuss what is so important for our country. Consistent with Goal 3 of the Sustainable Development Goals, which calls for affordable health for everyone. We as a people have been discussing this at the concept of providing affordable health care for our people. Bearing in mind that none of our citizens should die because he or she does not have money to foot hospital bill. So as a country, we have been working through a lot of different steps and processes that have led us here today. With this being said, it gives you a picture of how important our gathering here today is. So not to bore you, may I take this time to officially welcome all of us to this all important program. Ladies and gentlemen, I thank you.
Thank you, Honorable Chair, for that very welcome remark. You are now welcome to this section. We are striving to achieve Goal 3 of the SDGs. Now for remark. We'll now go on the World Bank Country Office for the remark. Mr. Collins, Chancellor, the World Bank Health TTL for Liberia, World Health Organization, Country Office, I'm told they are en route. Our international partners will now take remarks from the RPG representatives that are here. We will first start with NACO. for the brief remark.
Good morning, everyone. I'm going to sit here and hold you. I think we are all here for one important reason, to make sure that everybody, all Liberians, have access to healthcare. His Excellency, the vision is a long time ago. We even talked about this at his recently State of the Nation address. I think it's important that this initiative is undertaken. Michael, as a key stakeholder of this agenda, will do all they can to make sure that we achieve what is needed for city. So, on behalf of Michael, Police State President, thank you for coming, and to the high table, Pablo, Representative Actuarial, and Joel. Thank you for coming and with your attendance here today. It shows your dedication and your support for the design. Thank you, everyone.
Thank you. We are now going to ensure that this endeavor is achieved, and we'll work with all the stakeholders to ensure that this endeavor will not go down the drain. Thank you, Ali. We'll now go on BIH to speak on behalf of the RPT revenue. BIH is on my way.
I'm not here to tell the Ministry of Health of Liberia that this is a giant step that Liberia has made, because as we all know, Liberia is one of the countries that is making intentional progress towards achieving universal health coverage. And as always, BIH is here to support you through every step of the way. Thank you.
Powerful statement. See that the president a giant steps in achieving universal health coverage. Our embarrassing lesson. Sorry. Oh, I left my person here. Sorry. We have heard from the insurance group. We have heard from the partner group. All pledges support and willingness for this social health insurance. Now it's time now to have an government side. We'll now go on the office of the President through the Director General of the Cabinet. I will now turn in people for every remark. Paco, sorry, I agree to get to the meeting. I'm sorry,
Good morning, everyone. Honorable Joel, Honorable Mike, Honorable Kumawira. Are you on here? The executives of the Ministry of Health and participants and supporters of this important project. As Janako said, this has been on the President's agenda even long before he became President. Which is why when he expressed annual message, it clearly stated its key interest in ensuring that every Liberian affords or is able to afford health care. And he reiterated that during the second annual audit as well. So this has been very important for him. For several reasons, of course, including that every Liberian in this country must have access to universal health care. Every Liberian must have the opportunity to avoid disparities within health care. Every Liberian must have access despite your background, despite your status, and even despite your income. Because it is a human right for everyone to be able to go to the hospital and achieve the best outcome of his or her health. Which is why we believe that as a country, irrespective of government, we must ensure that this project, this vision, to achieve universal health care in Nigeria happens in a very short time frame as we envision. And universal health care, of course, ensures a just society. You find so many people dying from common diseases, that can be cured. Principally because they don't have the means for health care, or even provide, or even get drugs that they need for solving those health situations. So I encourage you that you take this very seriously. Not only the actuarial report that is coming out today, the validation, but also the bill itself. I think everyone should be involved. Every stakeholder should take this very seriously, because it will be one of the most important landmark achievements that we as Liberians can make. Healthcare is a right. It's not a privilege. It's a human right. So we should do everything possible to let it happen. I'd like to thank the Ministry of Health for working so hard on this, and the partners both in the private sector and the civil society and the NGO community. We'll work with you from the Office of the President to make sure that we get to this point. Hopefully, by the time the President makes his third annual message, we all will be able to say, yes, we will be able to achieve universal health care for everybody. So I'd like to encourage you. I'd like to thank you so much for coming. And please keep the faith. I'll be with you if you can as well. Which demonstrates how seriously the Office of the President takes it. Thank you.
Keep the faith. Very began. It is on the President's agenda. Is in the arrest agenda for inclusive development. It was issued his annual message. But we achieved it in short run. It is very important on the of the President act. That was the message from the President's office. We will not take on Honorable Austin Chiwuro, alternate public chair on behalf of to make remark on behalf of the House of Representatives, on behalf of the committee, on health. Why the oral man come and put the current off?
Welcome. Thank you. Good morning, everybody. Thank you again for the invite. Let me recognize the high table. I want to recognize all of you that have come today for this important meeting, and extend my thanks and appreciation to the Ministry of Health for taking over this bold initiative. Something that we have long been waiting for. That at this time we can hear about it. I think it's a plus, and that we want to say thank you ever so much. We feel that this initiative should not just be talked about, but this time around we should be implemented, knowing to the fact that what is been happening in the community, we that representing you in the rural community, we know the difficulty we face with our people. Though we have always said that we have 3 capital functions, but I think it's more than 3 now, because we are paying all the bills from our people. And so for being this help scheme, we help our people that will save life, that somebody who should have lost their life because of shortage will be able to go through to make sure that we pay the hospital bills or even transport themselves. Maybe the ambulance, people have to buy gas, and we feel that this is not necessary for our people because the president has said that in the arrest agenda, the people have come first. So we at the House of Representatives will make sure that, especially for the Committee on Health, we are going to give you our fullest support, and it is good that we are part of this process because we understand exactly how it comes out, so that tomorrow we can interpret it to the people. So again, on behalf of the health committees from the House of Representatives, I want to say thank you, and you can rest assured that we will give you our fullest support to make sure that this thing is implemented to the letter. Thank you.
We will do our part from the House of Representatives to ensure that the bill is passed so it can be implemented. Yes, it's the underweighted thing. We should be talking about implementing this thing, not just to be discussing it. It will cut down costs, hardship for the people in our constituencies. So say the honorable representative. While we are waiting the current, I want for the Ways and Means to speak in the mark. I know, but the current just going off and on. Yeah, you know, the partner fee speaking, the insurance broker fee speaking, the director of care fee speaking, the representative fee speaking, and Ways and Means to speak now. Anyone we school is a Ways and Means committee? Aha, they're coming now. So still we are waiting the current. I know you have the version project there that the people from the house and speak for long. We'll now call on the Ways and Means committee of the House of Representatives. Chair, Honorable P. Mark Jure, to make a remark, a comprehensive remark to this session. You are clapping too low. The chair,
You are clapping too low because you did not introduce us correctly. So let me start by introducing myself correctly. I come from the land of sunshine and happiness, and I represent the people of Harper District number 1. My full name is Practitioner Julia Ju Mike Ju. I'm glad to be here this time because I witnessed the beginning of this initiative in Buchanan. The Honorable Nathaniel Kwabo, I'd like to recognize your presence with my colleagues out there from the House of Representatives. I recognize your presence here, fellow late Liberians. Superintendent, one of my colleagues is sitting out there. Baron Zanwie. Yes, I recognize you because if you are an honorable, you are honorable forever. Health workers, fellow Liberians. Today, I think it's history in the making, and I'm glad to be a part of this history. Liberia Health Equity Funds that we discussed a few years back in Buchanan is coming to realization after this stakeholders meeting, and I hope we can get there. In my understanding, this equity fund should aim to address health disparities by providing financial, and that is why when he was calling me, I said he needed to introduce me the right way. by providing financial resources to improve access to healthcare and address the root causes of health inequalities, particularly for our marginalized and vulnerable populations in this country. I know there are different types of equity funds. I hope this program that we are about to discuss will cover the General Health Equity Fund and the Special Health Equity Fund. I do know from previous discussions that the General Health Equity Fund aims to address inequalities across this country, to provide health care, quality of care, and addresses social determinants for our poor people. And the Special Health Funds should cover people with diabetes, people with epilepsies, and different categories. Being a part of the beginning, I don't know whether today is going to be the end, but being a part of this process today, I'm glad that we are having this big stakeholders engagement. And I pray that by the end of this stakeholders engagement, Liberia should move one step forward. Since I'm representing the House of Representatives here, on behalf of the members of the House of Representatives, and in my capacity as the chairman on the Ways, Means and Finance, I'd like to pledge the support of the House of Representatives in working with the Ministry of Finance to get this initiative underway. Whatever we can do, the Speaker asked me to promise that we will be there to work together to ensure quality of health, particularly for vulnerable populations in this country. I'd like to say thank you.
Next one, diplomat. You told them just spoke at diplomat. So I had you back and speak. Thank you. So we pledge our support on behalf of the House of Representatives, work with the Minister of Finance to ensure that all the necessary steps will be done to get it started. Thank you, all representatives. I had to come to learn in DC well. So I'm told that our representative here, his speaker, his office is present here. So we just called his representative or remote representative to make a brief remark. Then after that, we'll take the next representative and then move forward. This mic thing is, I'm getting confused about it. You know, I want to put it in here.
Good morning, ladies and gentlemen. My name is Nuwo Kalang. I am the Chief of Office Staff in the offices of Senator Prince Moy, who is Senator of Bond County and Chair of the Senate Committee on Ways, Means, Finance and Budget. We all have known somebody who has been a victim of an inequitable healthcare system. You know, it could be a friend, a relative, a member of our organization, you know, a colleague, a workmate, you know, but we all know somebody who, you know, couldn't survive or couldn't access healthcare because they just couldn't afford it right here in Liberia. And primary and preventative healthcare services should be a must for everyone, every Liberian, regardless of social and economic status or political or religious affiliation. And so it is incumbent upon us, all of us here attending this dialogue, to muster the courage and put together our ideas, brainstorm, right? And then push the legislature to source resources for financing this program so that everyone throughout the length and breadth of the country, not only in Monrovia, but in the remotest parts of the country, can have access to equitable healthcare services. As Representative Jure pledged, the Senate is also prepared to work with their counterparts in the House of Representatives and to work with the Ministry of Finance and Development Planning and all other partners and stakeholders in making this dream a reality. And as we deliberate here today, you know, I hope that we bear in mind the most vulnerable of our population, the most economically challenged among us, and tailor the solutions to this problem in ways and forms that address the needs of those vulnerable groups of people. On behalf of the Senate Committee on Ways, Means, and Finance, we want to extend sincere appreciation to everyone putting in efforts to advance this cause, and we can assure you of the committee and the Senate in general, we can assure you of their unwavering commitment and support to this process. Thank you, and I wish you a successful dialogue.
As a senator, the people have come first. So as chairman of the Ways and Means of the Senate, we'll work along with our colleagues in the lower house to ensure that this bill is passed adequately and that something will stop of that issue. So then we say that, and we'll mark it against them, taking it small. Thank you. We'll now call on our Dawon Greekia, District Number 6 Representative Nima Kande, to make a brief remark. I hope I can make it name correctly. If you can tell me for continue, me my card down and everyone down go.
Good morning to all. Yes, I'm Dawon Greekia. I represent District Number 6, Nima Kante. I'm the co-chair on the Houses Committee on Ways, Means, and Finance. Not much I have to say because my chairman has spoken. He has pledged our support to this process, and we hope that we can all do it together to get the best for our people. Thank you.
No need to reinvent the wheel. The chairman has spoken, and we follow suit. Well, we are still waiting the query to come. Okay. So go downstairs and do group photo. And after the group photo, come back for presentation. Thank you. Crooks.
This is the health financing.
Can we take a photo here?
Dialogue of Liberia Health Equity Fund, social health insurance scheme, universal health coverage, and it's the stakeholders meeting to validate actual analysis.
So we'll just take short of the remark of this section from the minister's office. Then we'll go down for the group photo. After the group photo, we'll come back for the presentation. Is that okay? So we'll now call on the Ministry of Health through the Office of the Deputy Minister for President Planning MAE, Anthony R. Malaya Tamatio, to officially open the section as we move for the group photo downstairs.
Our hard table, fellow colleagues, at this time I want to come clearly to recognize the civil society organizations or their representatives here present, our international partners as well. I spoke earlier. I didn't know I was going to come to speak the second time. But given the protocol, my boss, the Minister of Health, has asked that I represent all year. And obviously, it is an obligation that I cannot waver on. What is important for all of us to note that a healthy population is the foundation of any development you think about. Without a healthy population, forget about development, you'll never achieve it. So what we have gathered here to do is in the interest of promoting a healthy population. At this point, on behalf, and if I can obtain your permission, the Office of the President, I want to officially announce this program open on behalf of the Minister and the Office of the President. Ladies and gentlemen.
Yes, folks.
Thank you, Minister of Health, for the opening section of the remark. We cannot go downstairs now for the group photo. It takes more air, come back.
Your issue has officially opened.
From the photo, not group photo, right? From the photo.
The hotel here.
The place dark, can't take photo here, man. I know your step is too short for all the players.
Some of the participants,
Mrs.
Collins, TTL of Liberia, and I have Honorable Nathaniel Kwabo, the Director of the Cabinet. We have Honorable Prince Mui, who is being represented by the Chief of Office Stars